Hello, everyone. Welcome to our Women's Health online talk. I'm Josephine Trotter, and I'm the Head of Marketing and Sales, and I'm delighted to be joined by Dr. Victoria Fielding, our GP and Women's Health Specialist here at the McIndoe Centre. Since the beginning of her career as a GP, Dr. Fielding has had a strong interest in women's health, and over the next hour, she'll be sharing expert advice on the importance of women's health and the key areas we should be focusing on and why. Before I hand over to Dr. Fielding, just a quick reminder that this is a live event and the recording will be emailed to you tomorrow. We're not able to respond to raised hands, so please pop any questions into the Q&A box and we'll answer them at the end. If you'd like to stay anonymous, just tick the box when submitting your question. And with that, I'm very pleased to hand over to Dr. Fielding.
Hello, thanks Josephine, and welcome to everybody. Thank you so much for coming and having a listen to my talk about women's health, something I'm definitely a strong advocate for. And we've titled the presentation tonight, Check, Screen and Protect. Obviously, it's a big topic, so I've just picked certain things that I think are really relevant to talk through. But yeah, feel free to pop some questions in the question and answer, and I'll do my best to try and answer them. So to begin with, I thought it might be helpful to think about why do we need to consider women's health differently to men's? Why does it need its own separate entity? And I think what's really important for us all to be aware of is that there is a huge women's health gap or gender gap in the UK. And actually, it's the largest across the G20. And what I mean by that is the difference based on gender alone on prevalence of disease, health outcomes, and our access to healthcare. Okay. And women live longer than men, but we are more likely to live in poorer health than men, on average 3 years longer in poorer health than men. We make less visits to the GP than men, and we're less likely to receive our health monitoring, whether that's our screening or going for cholesterol checks. And 80% of women feel that medical professionals haven't listened to them or haven't believed them when they presented with symptoms. Really worrying. Women, especially Black women, are much more likely to experience pain bias. That's where a health professional overlooks or ignores the level of pain they feel. And women are half as likely to receive pain relief after an operation. That's a terrifying figure. One Danish study identified 770 diseases in which women receive, on average, a later diagnosis than men. So why is it there? Why does this gender gap exist? Well, I saw a funny meme on the internet that said, why do all women's problems start with men? We've got the menopause, we've got mental health, we've got menstruation. And look, of course, all our problems don't start with men, just some of them. But I would say that probably men named our problems because traditionally they were the scientists, they were the doctors, right? And within that, women traditionally were really underrepresented in clinical trials. And part of this, correctly, was born from a fear of harming potentially pregnant women. And there are some horrible examples in history where that happened, right? But there was also a concern that the hormonal fluctuations might affect the results within trials. And then this general belief that men could represent all human bodies. And the reality is we now just know significantly less about female biology compared to men's. The other thing is we're less likely to seek medical advice. And I don't know about you, but I think that's a combination of factors. I think we're often the caregivers, right? We're often juggling multiple balls, and getting to the GP is often the last thing on our list. We might have a financial restraint to seeking medical advice. I had a woman today, in fact, who was just really embarrassed to have to admit that she had a medical problem. And she said, I feel like I'm making a fuss. Oh, that's said to me so many times. She wasn't making a fuss. She had an absolute legitimate medical problem that needed advice. But yeah. And then the other problem that we have is a lot of the treatment options out there were based on male biology. They were created for men, so they may not work as well on women. So to summarize, we're less likely to go to the GP or the doctor. We're less likely to be listened to and believed. And then when we finally do get a diagnosis, we're less likely to receive a treatment that's been designed for our bodies. And if hopefully that's not depressed you too much that you've switched off, because I do think there's some hope for the future, because I think we're becoming more aware of this gender health gap. And in August 22, the UK government actually created the Women's Health Strategy, which is a 10-year strategy to improve the gender gap. So help is coming, hopefully. And then the other thing I thought was really fascinating out there is Belinda Gates and her Gates Foundation, and she's promised a huge investment in women's health particularly. So yeah, that's definitely one to watch. I'm going to move on to talk through some different topics, and obviously it's quite a big subject, women's health, so I picked some topics. To begin with, I picked some stages of life that I thought would be worth talking through because they come up daily in my clinical practice. And then I picked some specific diseases to mention and discuss through, and a little bit about aging well. Okay. So, periods, menstruation. Oh, I found this horrifying fact. 37.5 years of our lives we have periods on average. And 1 in 10 women have very heavy periods, quite high, 1 in 10. And by very heavy, I mean so much so that it severely impacts your well-being and your daily life, or when you're bleeding. And they have so many effects, difficult periods, don't they? Whether it's the pain or rushing to get to the loo because they're heavy, and just really impactful on our lives, whether it's meaning that we can't attend school, meaning that we don't get as good at grades, meaning that we struggle in the workplace, really big impact. And the other thing that I think not many of us are aware of is that 40% of women under the age of 24 in the US and the UK as well are iron deficient. That's a huge proportion of the female population, and something really to be aware of in our diets. If you're heavily bleeding, thinking about your iron intake, and how do you present when you're iron deficient or anemic? Well, you get tired a lot. You don't have much motivation to do things. If it gets really severe, you might get breathless, or you might notice some changes in your hair and skin. And definitely important to see a doctor and try and get a blood test to check your iron levels and whether you're anemic, your hemoglobin level. Yeah. Just to mention there as well is that bleeding in between your periods and after intercourse should always be investigated. It doesn't always have a sinister cause, but it should absolutely always be investigated. The other condition to mention that I wanted to talk through was PMS and PMDD. PMDD, if you haven't heard of it, is called premenstrual dysmorphic disorder, dysphoric disorder, sorry. And basically it's PMT, but on speed. It's a horrible condition where you get really severe mental health problems. You can feel suicidal, very severely depressed just before your period starts. So it's in the luteal phase after you've ovulated, and it often is eased by your period arriving. And if any of you are unlucky enough to suffer this, please do go seek advice from a doctor. There are some treatment options out there. There's also some growing evidence around some really interesting herbal remedies, Agnus castus, and there's a B6 vitamin, which has some growing evidence. We need a bit more research into it, but yeah, something to look out for, absolutely. So I'm going to move on to contraception. Definitely something I'm a big fan of. And I have some extra diplomas in contraception, and I fit coils and implants. And I don't think we do it very well in this country. I think you tend to go to the doctor when you first need contraception, and you tend to get given a pill, and it tends to be microgynon because that's the one that all the GPs know about. And then you keep taking it because it kind of works, and it's easy to take. And I just wanted to talk about how there are loads of options out there. And also your contraceptive needs change over your lifetime, right? The big kind of buzz question in the contraceptive world and I've stolen this from another doctor because I love it. She's called Dr. Connolly, and she's like the guru of contraception. And her question is always, how not pregnant do you want to be? And that changes through life, right? When you're in your early teens and you're studying and you're at school or university, you absolutely don't want to fall pregnant. But later on, it may not be the end of the world if you do fall pregnant, even if you're not planning to conceive. And so those contraceptive needs change, and you are less willing or more willing to accept side effects from contraception, depending on how not pregnant you want to be. Sometimes it is about trying alternatives. I'm a big fan of the coils. I think they're a fabulous option. They give you good long-term acting reversible contraception. The Marina coil in particular, 8 years contraceptive cover, and 80% of women end up stopping bleeding. So yeah, a great treatment for heavy bleeding as well. Just to mention that HRT is not contraception, and that all women should be able to stop contraception at the age of 55. So it's still a fair bit of your life where you need to consider it. Moving on to the postnatal period. Obviously, I'm conscious it doesn't happen for all women, but I will just mention it because I just think it's a fascinating period of time of a woman's life, and one that I think is really studied and undervalued, because this is the moment where you lose all ability to focus on yourself. And a lot of the habits that you form during this time when you're looking after your children are with you for life. And you've got so many things that you need to recover from. You've got pregnancy to recover from. You've got the mental side of recovering from the delivery, from having a newborn baby. Then you've got recovering from the birth itself, whether that's a cesarean section or a vaginal delivery. And with that, all the complications, the wonderful complications that come, like hemorrhoids and bladder and bowel control. So yeah, a really interesting period of time in lots of women's life, realize not all. And I get a lot of questions about bladder and bowel control, and a lot of concern. I definitely think this is the moment of your life to focus on it, because having a pregnancy is just that pelvic floor takes a battering. And what can you do to help? Certainly exercise, trying to keep your weight normal and doing your pelvic floor exercises. And if you're struggling, actually seeking advice early and going to see a pelvic floor physiotherapist can make the world of difference. They're fabulous creatures. So yeah, absolutely go and get advice if you're struggling. Then the big one, perimenopause and the menopause. Gosh, I mean, I've been a GP for a wee while now, and it just feels like it's exploding, this topic. Such a big, and we're becoming more aware of it, aren't we? And the impact on women's life, and the evidence is out there. Actually, you know, it costs the UK economy £10 billion, and 1 in 10 women are leaving work because of the menopause. So it's a huge topic and a really important life stage, and we all go through it. The average age of the menopause, and by the menopause I mean when you haven't had a period for a year, is 51. And the perimenopause is the bit before, and that's due to fluctuations in your hormones, and as your ovarian supply starts to deplete. And that period of time on average lasts 7 years. And so many ranging symptoms, many of them you'll know about, but it's the flushing, it's the night sweats, it's the poor sleep, it's the mental health changes, that whether that's anxiety or irritability, it's the vaginal dryness, it's the low libido. Other ones that lots of women, it's quite common and lots of women don't know about, are vertigo. It's quite a common one. Palpitations, brain fog, really big ones. And that would be my tagline, that bit at the top. I just don't feel myself. I reckon that's what I get told the most when women are struggling with the perimenopause. So what can we do about it? Well, there's loads of treatment options out there. And I think if you are really struggling with it, go and seek advice from somebody that you trust to talk it through with. I definitely think lifestyle factors around the menopause and the perimenopause are minimized. We know that women who smoke, who drink too much alcohol, who don't do any exercise, who are stressed, who have family history of bad menopauses tend to have bad menopauses, okay? So if you can improve any of those lifestyle factors, go for it, because not only will it help with you the perimenopause, but it will help you through life, right? So definitely a key area to look at. And some things you can change and some things you can't. The evidence shows that for most women, the benefits of taking HRT outweigh the risks if taken for 5 to 10 years. And certainly under the age of 60, I would absolutely agree with that the benefits of taking HRT for most of us outweigh the negatives. It doesn't suit everybody, but definitely loads of options out there of how to take it. I would really advocate, if you are struggling with the perimenopause and menopause, perhaps going to a group and having an opportunity to talk with other women who are experiencing it. There are a lot of menopause cafes popping up all over the UK, and they get great reviews and just give you an opportunity to talk to other women who are experiencing the same. I actually do group consults for HRT and menopause in my NHS practice, and I get lovely feedback from them. So yeah, definitely something to consider. Alternatives to HRT tend to focus on specific symptoms. For example, vaginal dryness. You can use vaginal estrogen, which is super safe, and you can actually buy it over the counter. If flushing is your concern and you don't really want to take HRT for a particular reason, we can use antidepressants. There's one called venlafaxine, which is very good for flushing in particular. I get lots of questions about supplements and what supplements should I take, and I'm bombarded by all these adverts. Which one should I use? Actually, there's not very good evidence for any of them, and I think a lot of these companies are taking our money. I think the one that is interesting is the isoflavones, which is the compound that's in soy, and it acts very similarly to estrogen in our bodies. And we know that women in Japan don't seem to complain of the menopause as much as other women. And we think it's because they have a lot of soy in their diet. So that's definitely, for me, one that would be safe to try if you wanted to, or trying to get more soy in your diet is another way to do it. I'm sure there will be questions about the perimenopause. Go for it. So I'm going to move on to aging well as a woman, and I'm just going to talk about some specific conditions, and then I have got some specific female cancers as well. So osteoporosis. Did you know that half of women over 50 will have a low trauma fracture in their lifetime? So that's a fracture from a simple trip up. And our bone density reduces as we hit the menopause and our estrogen level drops. That's why we're more at risk of it from men. You're also more at risk if you have a family history of osteoporosis, or you've got a low BMI, or you're a smoker. And how can we help prevent osteoporosis? Well, taking HRT is one way of doing it that is helpful for our bones. We know that. The other things that are really important are making sure we're eating enough calcium in our diets. And there's some really good resources online called Calcium Calculator. Just put it into Google. The National Osteoporosis Charity has a great free one, and you can go through your diet and make sure that you're getting enough. The other thing you can do is take a vitamin D supplement. Really important through our lifetime, especially over the winter months. So from October to March, we should all take a vitamin D supplement. And if you have black or brown skin, actually in the UK, you should take it all year round. That's really key. Weight-bearing exercise. So weight-bearing exercise, what do I mean by that? That's the running and the walking and the cycling. Really important for our bone health. Absolutely. I get lots of questions about exercise and what should I do? How much should I do? What's good for me? So the evidence is quite good on this. We should all be aiming for 150 minutes of moderate intensity exercise or 75 minutes of heavily intensity exercise. Going back to the moderate intensity, what I mean by that is you couldn't have a conversation. So you get a little bit hot and sweaty and you can feel your heart beating a little bit. But you're not drenched in sweat. That's the high intensity exercise. And again, you want a mixture of cardiovascular, weightlifting if you can, and also anything that's balance enhancing. Really key as we age that we focus on our balance and improving on it because we don't want to fall. Next, I've got dementia, which is the leading cause of death in the UK in women. All right. Partly that is due to because the fact that we live longer, but the evidence is that twice as many women than men have Alzheimer's in the UK. And there is no clear link between menopause, but I think that might change over time. And research is being done into this. Okay. Lifestyle is absolutely key here, actually. Really good evidence that improving our lifestyle can reduce our risk of dementia and Alzheimer's disease. Growing evidence around our diet being key here, a plant-rich diet, and also minimizing the ultra-processed foods that we have in our diet. Also, lots of evidence about keeping our brain active, how that's really important. What do I mean by that? Doing those puzzles, doing Sudokus, doing crosswords, and also making sure you're still socially interacting. And that's why actually getting your eyes checked, getting your ears checked is really important as you age, because you want to make sure that you can socially interact, you're not missing things. Another really important topic is heart disease, and one that I don't think we're very good at recognizing in women. It's still the second leading cause of death in women in the UK, so it's absolutely a very important disease to be aware of. And we often present differently than men. And we're 50% more likely to be misdiagnosed compared to a man, all right? And we're more likely to present atypically, so not the typical chest pain, which this lady in the photo is expertly showing. Actually, it tends to be the nausea, the shortness of breath, and the dizziness. I had a patient a couple of months ago that had no chest pain. She was just getting dizzy when she walked, and it was angina. And thankfully, she got some treatment and has done really well. But yeah, prevention is absolutely key and trying to reduce your risk. So what do I mean by that? It's thinking about your risk factors. That's your blood pressure control. That's checking your cholesterol. And that's, again, back to that lifestyle of exercising well, not drinking too much alcohol, and not smoking. Okay, I'm moving on to the cancers now. So it's the most common cancer in the UK. And 1 in 7 women are going to develop breast cancer in their lifetime. And the worrying fact is that over half of the UK women do not check their breasts regularly. I tend to advocate doing it in the shower and at least once a month. And if you're unsure of how to do it, there's a fabulous charity called Copperfield, which if you haven't looked at, please do. It's brilliant and shows you exactly how to do it. I think, again, just being aware of how to reduce your risk of developing breast cancer. And I'm back to that lifestyle factors again. But yeah, reducing your alcohol intake, not smoking, exercising regularly, loads of evidence that it reduces your risk of breast cancer in particular. And don't forget, the NHS does offer breast screening and mammograms for all women aged 50 to 71 every 3 years. I'm hoping you can see this one okay. I love this chart. I use it all the time. Especially when I'm talking about HRT risk with women. So this is risk factors for breast cancer. And if you can see the little blue figures in the age range that they've picked, so it's age 50 to 59, in 1,000 women over a 5-year period, you're going to get 23 cases of breast cancer in the background general population. If you throw in combined HRT, you're going to get 4 extra cases in 1,000 women. You see the one right down at the bottom, second to the bottom. You're going to get an extra additional 24 cases if you're overweight or obese. So actually, what is much more of a risk factor than taking HRT or even smoking is being overweight or obese. So definitely, if you've got a family history of breast cancer, I think having a good awareness of those risk factors, and even if you don't have a family history, because it's common. Yeah. Cervical cancer. I thought I'd mention this one again because it's coming up a lot at the minute, and I'm not sure if all of you are aware, because doesn't seem to have been mentioned that much in the press, but the UK smear programme has changed in this past 6 months, and they're now only offering smears every 5 years to all women aged 25 to 64. I'm getting a lot of concerned women because of it, especially if they've had positive cervical smears in the past. And again, I think it's just having an awareness of symptoms with cervical cancer, and mainly it's irregular bleeding. And certainly a red flag for me with cervical cancer is bleeding after intercourse. That should always be investigated. If this is a disease, unfortunately, of young women, the peak incidence is age 30 to 34, and there is another peak over the age of 55. Don't smoke, that will reduce your risk factor. Go for your smears. If you're eligible for the HPV vaccine, please have one. So much evidence for this now, and we're going to see a massive drop in our cervical cancer rates, I would predict, because of the HPV vaccination program. And yeah, just making sure that you present early if you are getting some irregular bleeding. So prevention is key. I really like this picture on the right because I think it gives a little good summary to try and. It's going for your regular checkups. It's getting your blood pressure checked, your cholesterol checked with a medical professional, checking for diabetes. It's attending for your vaccines if you're eligible for them. It's going for your screening, whether it's cervical smears or mammograms, and getting these little lifestyle check-ins. I think they can be really important because life's busy. It's hard to juggle all these things. But yeah, are you exercising enough? Are you eating well? Are you not smoking? Are you drinking too much? What's your weight? Just those little check-ins can be really key in this. And yeah, I think it's, as I come to the end, I hope I haven't overwhelmed you. I think it can feel a bit overwhelming how to stay well and age well. And yeah, we are here to help at the McIndoe. We offer obviously the women's overall wellbeing service where we have like the full screening, full health check if you want it. But there are also some individual blood tests that you can have, or cervical screens or breast checks. So we are here to help. If you want to talk through what's available, you'd be very welcome. Any questions?
Right. Hello, I'm back again. Thank you very much for that. That was incredibly interesting. It is such a huge subject, isn't it?
It is.
I just want to say quite a few people have signed in a little bit late. If you don't worry, you haven't missed anything because we're going to be emailing a video of this presentation to all of you tomorrow. Also, Dr. Fielding has mentioned a few websites as well for sourcing really interesting information. In particular, I think it was Copperfield, I remember. We'll list those in the email when we send them to you. Other than that, if you have any questions, I haven't got any pulled through at the moment. Can you pop them into the Q&A box at the top there? And hopefully we'll get something through. In the meantime, I do have one which came up, which was somebody mentioned earlier, which was we have a cervical smear test that is available at the McIndoe Centre, which you can book online. And I think there does seem to be a little bit of confusion between the particular cervical smear that we are offering versus the NHS smear, and that would be really helpful to know.
Yeah, there is a subtle difference to it, but an important one. So on the NHS cervical screen, what they do is they look for the HPV virus. And if they find the HPV virus, they look at the cells collected from the smear test under the microscope. And then obviously if they see any changes, they might refer you on for further tests. Our screens, every sample, we check for the HPV virus, and also we look at the cells under the microscope. So even if you don't have the HPV virus currently, we will still check the cells. So it's just a bit of an added check.
Right, okay, thank you. Right, I've got one here. It's been a year since I had my baby and I still have bladder issues. Is that normal?
Yes. It definitely takes a good year post-delivery for things to improve, but I would hope they would be starting to improve now. I think, if you're feeling worried that things may not have totally recovered, and obviously it depends if you've had a vaginal delivery or a cesarean a little bit, but it may be worthwhile going and seeing a doctor and having a vaginal examination. And definitely important to focus on your pelvic floor, your Kegel exercises. And if you're struggling with it, I would really advocate going and seeing a specific pelvic floor physiotherapist. They can be really worth their weight in gold and make such a big impact. So yes, it's normal, but I would hope it would be starting to recover.
Right, okay, thank you. What's the single most important lifestyle change for women's health?
Exercise. They say if exercise was a drug, it would all be on our repeats.
Yes, I'd quite like to just plug in my body when I go to bed and leave
Wouldn't that be nice?
working on the treadmill. Wouldn't it be great?
It would be, really, really, like, so much evidence that it helps with, all diseases.
Right. Are there any apps that you would recommend for tracking screenings and health checks?
Not that I know of for screening, no. There's kind of, but not that I know of tracking screening, I'm sorry.
No, I think there are some that you can get that are associated with private medical insurance apps and things like that, but you get them as part of your private medical cover. I know
the Eve Appeal, the website, they will check if your screening is due, if you're unsure, because I've had a few women come through there. Yeah, that's the Eve Appeal, but I don't know an app. I'm sorry.
Right. Okay. Right, I have to keep refreshing to pull these through, so bear with me. I've often felt dismissed when talking about period pain with my GP. What can I do for my concerns to be taken seriously?
If you can find a GP within the practice that has a special interest in women's health, that can definitely be to your benefit. I think writing down how it's impacting your life and your well-being, just so that you're really emphasizing the point. Perhaps going armed with some suggestions of what might be helpful. There are so many treatment options out there. So I definitely don't want you to feel dismissed, because it can be absolutely horrible. There are non-hormonal options. There are hormonal options. The Mirena coil is fabulous for heavy, difficult, painful periods. Don't give up.
Right, thank you. Actually, that leads into the next one very well. I'm nervous about trying a coil because of pain stories. Is there anything that can be done to relax me, or to reduce the pain?
Yes, there is. You can give some local anaesthetic to the cervix called xylocaine. You can also use something called lidocaine, which is anaesthetic gel, which can give you some benefit, pain relief. You can take paracetamol, ibuprofen before you go for your procedure. That really helps lots of women. I'm not going to pretend it isn't uncomfortable having a coil fitted. I fit them. I've also got one myself. But remember, it doesn't last very long. That, you know, the intense part of the procedure is probably 4 minutes. So it doesn't last long, and it just gives you such good long-lasting contraception, or support with your periods, or part of your HRT. So yeah, some pain relief before you go, and asking for some local anaesthetic.
Right, I would agree with that. I think Marina Coil is an absolute game changer. Right, here we go. What symptoms should we look out for in ovarian cancer? And is there a screening test for it, e.g. ultrasound, yearly, private, or both the NHS? My understanding is that it's a silent cancer and usually diagnosed at a very advanced stage.
Yeah, it's a horrible cancer for exactly that reason. It often presents quite late because the signs initially can be quite subtle. Bloating is a big one that I get concerned by in a woman. Changes in bladder control, bowel changes. The other one, there was a really interesting study looking at women who've been diagnosed with ovarian cancer, and the 6 months before, they often went to the GP complaining of indigestion. So all symptoms and signs that are worth consulting a doctor about, especially if you've got a family history of these types of cancers, or any woman. There's no kind of NHS national screening program for ovarian cancer. And I don't think there's one in the pipeline. There is a blood test you can have called CA125, which is a tumor marker they look for. It's not perfect. You can still have ovarian cancer and have a normal CA125, and you can have a raised CA125 and not have ovarian cancer. So it's tricky. I think if you've got a significant family history of ovarian cancer, and you can, a private ovarian, ovarian scan, ultrasound scan, it's very safe to have, maybe worth considering.
Okay. Sorry, hang on. I'm worried about dementia because someone in my family had it. Are there early signs as a woman that I should watch for? How is it different from menopause, brain fog?
It is different. And I have lots of women, that's not an uncommon thing that women will come and say to me, and, do you think I'm getting dementia? I suppose I would say that brain fog tends to come with other menopausal signs. And it certainly tends to be around the menopausal age. I think actually, if you are concerned about memory, going and seeing a doctor and having a memory check is such a simple thing to do. And it's amazing that there is a significant difference between women who are developing dementia and brain fog when you start to drill down and do these dementia questions. They're pretty good screens, actually, the dementia screens that we have, and we do one as part of our women's health check. And I don't think we've ever got a positive result. And I've definitely had lots of women who are struggling with brain fog. So yeah, I do think brain fog, although it can be debilitating, is, the first signs of dementia are much more serious. And it tends to be your short-term memory with dementia that goes. Yeah.
Okay.
That's answered that.
That's reassuring. I struggle badly with PMS symptoms. Is there a connection between PMS and perimenopause symptoms?
Yes, I think probably something we don't know that much about, but I'm hoping that the evidence around it and the research into it will grow. We see lots of women who have suffered with PMS through their life. It worsens around the perimenopause, and it's probably just a sensitivity to certain hormonal changes. I think the difference between PMS for me and the perimenopause is PMS lifts with the period. Yeah. So it's cyclical. It's your luteal phase. So it's once your egg has been released. And it eases with the onset of bleeding. Whereas perimenopause, it can be much more variable and more persistent.
Right. Okay. I think I'm just refreshing the page. I think that's all the questions we have. Does anyone want to leave any? I would do it now. Hang on, let me just refresh again. Oh, we have another one. Right, how do you say it? Cystoscopy.
Cystoscopy?
Yes, secondary to HPV plus asymptomatic. Would it be recommended to go private for additional smear tests with national guidance algorithms move to 5 yearly?
I have to say, I had 2 patients last week where exactly like that, who had a normal colposcopy but felt very nervous about waiting for 3 or 5 years until their next smear. It's a difficult one. I think, and it's on an individual basis. I think if you can and you feel concerned about it, it's not doing any harm to your cervix having an additional smear in a check-in. I would definitely be concerned about bleeding, especially, as I said, irregularly or after intercourse. I would absolutely want you to go and present to a doctor. Yeah, it's a difficult one. Everybody is adjusting to this change. The evidence shows that it is safe, but the cynical side of me says that there must be some degree of concern over money and spending too much money. And that's why it has changed. But yeah.
I think it's people understanding what the change is as well, which is a big part of the issue. Okay, let me just have a look at this. I think that's all our questions. Okay. Yep, that's it. So all I can say before closing, this is all we have time for. So thank you, Dr. Fielding, for providing your expertise this evening. And thank you for everyone for joining us as well. If you'd like to book a consultation with Dr. Fielding, please get in touch via the contacts that are on screen in front of you. We currently have several offers here at the McIndoe Centre. The first is a free breast check when you book a cervical smear test this month. And the second is £150 off our essential women's health check. So do please visit our website, themcindowcentre.co.uk, or you can contact us again via the contacts that are on the screen in front of you. When you receive the recording of tonight's online talk, you will also receive a survey link with 3 quick questions for feedback. And we'd love to know your thoughts, what went well and what we can improve on. And we hope to see you in the future sessions. And most importantly, we encourage you to schedule your women's health check. Thank you very much. And please enjoy the rest of your evening.